Lymphoma Hub podcasts, brought to you by Scientific Education Support.
Hello and welcome to the Lymphoma Hub podcast. Today we'll be hearing from Pere Barba of Universitat Autónoma de Barcelona in Spain.
Hi, my name is Pere Barba and I'm leading the CAR T program at Vallebrón University Hospital in Barcelona, Spain. So if I had to answer to this question on what are the CAR T-cell therapies on the horizon for lymphoma, I would summarize in 5 different strategies. So of course, the first one would be the new platforms that are being investigated to produce second generation CAR T-cells against CD19. One of these platforms, and I was able to present this at the ASH meeting in New Orleans, is the T-Charge platform. So I presented the results of the phase 1 trial of rapcabtagene autoleucel, or YTB323, which is an anti-CD19 second generation CAR T, which is produced through this T-Charge platform that allows the production of CAR T-cells in less than 3 days. I presented data on safety and efficacy, which is very promising, and I'm sure this molecule will move to a next step of investigation and hopefully will be available pretty soon for patients. The second strategy would be using other antigens different than CD19. Several antigens are being investigated right now in clinical trials, including CD22, CD20, and CD37. Of course, these strategies are very promising. Patients had received prior anti-CD19 therapies, including the approved CAR Ts at the moment. The third strategy would be using dual CARs, which target 2 different antigens, for instance, CD19 and CD22, and this would lower the risk of relapse by escaping from the presentation of the single antigen, for instance, CD19, that CAR Ts are directed to right now. Finally, the fourth strategy, which is also being investigated in several CAR T trials, phase 1 and phase 2, are allogeneic CAR T platforms. I think this is a very promising way to move forward. These allogeneic CAR Ts are available off the shelf, so patients would have the infusion of CAR Ts the day after or almost immediately that they are indicated, and these would spare these patients to wait for 3 weeks as it happens right now. So these patients would not require, in theory, bridging therapy, and a higher number of patients would be candidates for this strategy. As I was mentioning, there are several trials from several companies and academic institutions evaluating safety and efficacy of allogeneic products in patients with lymphoma. Of course, there are other strategies, including combination of immunomodulators or checkpoint inhibitors or other small molecules with conventional CAR Ts that are also very promising. So I think the future we have ahead right now is very promising, not only in the long term, but also in the midterm. So I'm quite confident that the outcome of patients receiving CAR T-cell therapies will improve pretty soon. Thank you very much.
Thank you for listening to the Lymphoma Hub podcast. We would also like to thank our supporters, Bristol Myers Squibb, Genentech, Incyte, Pharmacyclics, Roche, Novartis, AstraZeneca, and BeiGene.
Lymphoma Hub podcasts, brought to you by Scientific Education Support.